One World Knowledge presents. What is coronavirus and why we need to know about this specific virus? We need to know about this virus because death toll has been dramatically increased. According to the World Health Organization, it is officially reported that a novel, new, coronavirus was identified by Chinese authorities on the 9th of January 2020. The virus is associated with an outbreak of pneumonia in Wuhan City, Hubei Province, China. Other countries are also expanding screenings of coronavirus in their airports and on borders. At least 82 dead and approximately 2,903 are infected as of the 27th of January 2020. It is now spread to 20 countries worldwide as of January 29, 2020, with 7,189 confirmed cases and 169 deaths in China alone. Coronaviruses are a group of viruses that cause diseases in both mammals and birds. The symptoms of coronaviruses varies and are quite similar to that of upper respiratory tract infection. Similarly, if a coronavirus infection spreads to the lower respiratory tract, that is to your lungs, then it can cause pneumonia, as can be seen in this new Wuhan strain. Human coronaviruses were first identified in the mid-1960s when they were found in the noses of patients with the common cold. The name coronavirus is equally derived from both the Latin and the Greek origin, and both has the same meaning, crown or halo. They get their name from their characteristic crown-like shape appearance if seen through electron microscope. They are single-stranded positive sense enveloped RNA viruses and are helical and spherical in shape. This is an image of coronavirus as can be seen through electron microscope. There are now 7 strains of human coronaviruses that we should know about. Number 1 is human coronavirus 229E. Number 2 is human coronavirus OC43. Number 3 is SARS. Number 4 is human coronavirus NL63 New Haven coronavirus. Number 5 is human coronavirus HKU1. Number 6 is Middle East Respiratory Syndrome coronavirus, MERS, previously known as novel coronavirus 2012. Number 7 is coronavirus 2019, also known as Wuhan pneumonia or Wuhan coronavirus. The Wuhan strain has been identified as a new strain of beta coronavirus from Group 2B with 70% genetic similarity to the SARS, which was first emerged in China in 2002 before spreading to other 29 countries in 2003 via traveling abroad. Now the real question is, does a face mask can save us from coronavirus infection? Yes, when used correctly, masks are highly effective in preventing the spread of viral infections in any surroundings. There are 2 types of mask you should know about. Number 1 is surgical face masks. Number 2 are respirators. Surgical face masks are loosely fitting disposable sheets which are approved by the United States Food and Drug Administration for the use in healthcare institutes. The sole purpose of these masks is to give us extra protection against sneezes and coughs. Now let's talk about respirators, which are also exclusively known as N95 respirator masks. They are basically designed to protect us from very small particles in the air that may contain viruses. According to the Centers for Disease Control and Prevention, this name is given because of the certainty that they are designed in such a way, if properly fitted, they can filter at least 95% of very small airborne particles. Do you know N95 respirators filter out most particles down to 0.3 microns in diameter? On the other hand, one should keep in mind that the coronavirus measures 0.12 microns in diameter. But are they as effective as their name predicts? Yes, it mostly depends upon how you wear them, or how often you wear them, along with good personal hygiene habits. Yes, face masks and respirators do have a power to reduce the spread of flu infections. But only if we wore them correctly and frequently during flu season. 4 guidelines for wearing face masks properly. Number 1. Must wear a face mask when coming within 6 feet of a sick person. Guideline number 2. Must wear a face mask before you decide to go near another person if you have the flu. Please consider wearing a face mask in crowded settings to avoid transmission of flu virus. Be reasonable. Please dispose of used tissues and handkerchiefs after using them. According to the Centers for Disease Control and Prevention, CDC, the best precautions are mostly the standard measurements that we should be taken on a daily basis. Some preventive measures for flu season. Number 1. Wash your hands as per required. Number 2. Avoid close contact with sick people wherever possible. Number 3. Drink plenty of fluids to stay hydrated. Number 4. Take over-the-counter medications like acetaminophen, ibuprofen or naproxen to reduce pain and fever. Number 5. Use a clean humidifier or cool mist vaporizer to prevent dryness and for easing some of the symptoms of the flu. Thank you for watching. Please subscribe for more.